President-elect Donald Trump showing signs of compromise on his plans for the Affordable Care Act. Mr. Trump repeatedly told supporters on the campaign trail that he wanted to repeal and replace Obamacare. Now he says at least two parts of the act are worth considering keeping.
When you replace it, are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that?
Also, with the children living with their parents for an extended period,
you're going to keep
very
that?
much try and keep that. Adds cost, but it's very much something we're going to try and keep.
And we want to bring in one of the architects of Obamacare, Dr. Ezekiel Emanuel, chairman of medical ethics and health policy at the University of Pennsylvania and a former White House special advisor to President Obama. Good to see you, Dr. Emanuel. Thanks so much for joining us.
Nice to be here.
How easy would that be to keep the pre-existing conditions element of the plan and children living with their parents under their plans and change everything else?
It's possible to keep the children up to age 26, whether they're living with their parents or not, and have them on their parents' insurance plan. It is not possible, let me repeat, not possible to have pre-existing condition exclusions preventing insurance companies from excluding people with things like cancer or multiple sclerosis or heart attacks and not have an individual mandate if you want a functioning insurance system. And that's always been the tension. The Republicans don't like that tension, but it is a law of insurance. If you want to have people who are sick in the insurance marketplace and buying at a reasonable cost, you have to have the mandate to get everyone in the system so that costs are balanced out. And you can't get rid of the mandate and keep that pre-existing condition exclusion. I noticed that Newt said, oh, we'll have high-risk pools. Let me tell you, those high-risk pools are the most inefficient way to provide insurance. They super concentrate people with illness, which means that the premiums are super high and require the government to provide very high subsidies so people can afford them.
Well,
they are not a way to go.
The premiums are already pretty high. We know that the growth in terms of the premiums have gone up significantly since this plan has been in place, and they're going to go up even more next year.
Excuse me, Maria. You have
on average, 25% is what everybody is expecting on average in 2017.
Wait, Maria, you have
Obamacare premiums to go up. And when you look
Maria,
at a state like Arizona, one second, Dr. Emanuel. When you look at a state like Arizona, you've got premiums going up 116% next year. Why is the Affordable Care Act so expensive?
First of all, Maria, you have the facts wrong. When the exchanges opened in 2013, the premiums were much lower than had been predicted. And now they're coming back to exactly where they were predicted because you have a change in the pool of who's in the plan.
Dr. Emanuel, exactly what fact did I get wrong?
You got the fact that they're higher than expected, first of all.
They're much higher than expected, Dr. Emanuel, and everybody says
Maria,
it. I speak with business people all the time, and the biggest expense for them is Obamacare. They refuse to hire more than 50 employees because they do not want to be on the forced to have to give health care benefits to them. That's number one.
Maria,
when I speak with individuals, they have seen their premiums skyrocket, and we've got a chart right now. Let's show that chart again, Rocco, to show the premiums what they have done. So my question was to you, Dr. Emanuel,
since this is my chart, Maria, maybe I can explain
going up
this.
so much in 2017?
Maria,
why
would you let me explain my
so much in 17?
Can you let me explain my chart? What that chart shows, if you please put it back up, is that the insurance premium, if the higher line is the Bush line, when healthcare inflation under Bush, the lower line and the bent line is healthcare inflation under President Obama, and the $4,000 difference between President Bush's line and President Obama's is how much we've saved by controlling costs. Now, we have had an increase of 22% in the exchanges. Many states, including the most populous states like California and New Jersey, have actually have under 10% increases, and some states like Indiana and Massachusetts have negative growth. Some states like Arizona, the only state with triple-digit increases. It is a one-time correction, and this is bringing insurance costs to where they are. If we really want to keep healthcare costs down,
is why is their healthcare costing them so much money and so much more than they thought so? Number one. Number two, why don't they have any choice? We know that United Healthcare has pulled out of the exchanges and the Affordable Care Act because they said they were going to lose $1 billion on the plan. We know what Humana has said and why they are avoiding it. We know what Aetna has said. So across the board, you've got the health insurers pulling out of the program. That's creating no choice, very little choice for people. So the whole
Maria,
idea of you can keep your doctor if you want your doctor, that was a complete lie. And now
Maria,
all the premiums
would you
are going
calm
up
down
in
so we
17.
can have a
I'm just simply trying to understand why premiums are going up so much.
Let me answer the question. Premiums are going up because health care costs are going up, and health care costs are going up because we have more sick people who've come in, and we haven't had enough healthy people come into the marketplace. That's the basic fact. That's why insurance premiums go up.
Okay.
And let's repeat the fact that insurance companies have had record enrollments, record profits, and they have plummeted, their stocks have plummeted in response to the election of Trump because he's going to disrupt the market, and actually no one knows where it's going because he has this contradiction of we don't want the mandate, but we want to get everyone with a pre-existing condition insurance. That will only drive prices up more because healthy people will not buy insurance. You want to see a big increase in your insurance prices? Just follow the fact that we won't have a mandate, but we'll insure everyone who has a pre-existing condition. That will destroy the insurance market.
Well, we're
and you
already
will hear a lot of complaints from
see
your
premiums
people.
go up. We know that from the White House, right? I mean, the government came out with the report 3 weeks ago to tell us that premiums are going up on average 25% in 17.
Maria,
Dr.
no one
Emanuel,
ever...
our viewers know this. No matter how many times you talk on top of me, it doesn't matter. They understand the issues.
No one ever said premiums were going to go down. The issue is how much do they go up from year to year. And the increase has moderated substantially under President Obama, as my graph showed. If we had continued with the inflation under President Bush, we'd have insurance premiums now that would be $4,000 higher than they are under President Obama.
So in other words, just as we wrap up here, you think the Affordable Care Act has been a success then?
Oh, it's definitely been a success. 22 million people with insurance. Health care cost increases have actually moderated. What many of your people, your audience is experiencing are two things. That is, drug prices going up because the drug industry has raised prices substantially, and people pay more of that bill.
How come you didn't see that? I mean, that's nothing new. This is, you know, people will pay for whatever the market will bear. How come you didn't know that when you put the plan together?
Look, many of us wanted to regulate drug prices, but we could not get it through Congress.
Right.
And the Republicans have not come to the table. Interestingly, President Trump, and I think this is one of the more positive indications, said that we do have to control drug prices. Both he and Hillary Clinton had agreed on that.
No,
now we'll
they never agreed on that. Donald Trump is a free markets person. He does not want to regulate drug prices. He never said that. That is absolutely inaccurate.
Maria, that is, you are not saying the truth. He did say that they were too high, and he said that we had to have reimportation from Canada and other measures to get drug prices down.
Dr. Emanuel, thank you. Thanks for joining us.
The facts
It was a lot
are
of
you're
fun.
not quoting it correctly.
Dr. Zeke Emanuel joining us. Thank you, sir.